Hello everybody. Today we are going to be talking about chiropractic neurology, which is sometimes referred to as functional neurology. They are interchangeable terms. I like to go by chiropractic neurology just because it's a little bit more straightforward and people tend to know a little bit more about what that means. Functional neurology can just be a little confusing. So it doesn't matter what term you use, but we'll refer to it as chiropractic neurology for today. For those of you that don't know, my name is Dr. Dan Perman. I am a board-certified chiropractic neurologist. I'm a clinician here at Root Cause Medical Clinic, bringing neurological rehab strategies to the area. I am the founder of a company called Virtual Brain Rehab. This is a totally virtual telemedicine resource for people dealing with neurological conditions. Unfortunately, there aren't that many of us out there, so I'm trying to be as accessible as possible. Now, doing work in person is obviously going to always be better, so we'd prefer to do it in person if possible. Some people will travel for that kind of care. That's why I'm here at Root Cause, because I think it's very important to still be able to deal with people in person. But for those people who cannot, make a trip or don't have anybody nearby, I like to have some kind of resource for them. As I said, I'm board certified in chiropractic neurology. It's an extra about 3 years of schooling on top of a traditional chiropractic degree, and it allows me to specialize in diagnosing various neurological conditions and also creating non-invasive rehabilitation plans to try to rehabilitate those problems as best as I can. Prior to this, I practiced for 6 years down south a little bit. I was in Santa Barbara for a bit, and then I ran a practice in Beverly Hills. I decided that I wanted to, settle down a little bit, so I moved up to the Bay Area, and that's what brought me to Root Cause. Before I got into rehab and chiropractic and all that kind of stuff, I was heavy into research. I did my undergraduate schooling in neuroscience, and I was fortunate to work in research at Harvard Medical School while I was a student in Boston. Really, really awesome. There are many conditions that chiropractic neurologists can treat, and we're gonna dig into that a little bit today. But the big ones that I focused on over the last 6 to 7 years of my career is migraine, concussion, and dizziness. It started just because, that's what they focused on at the first practice that I worked at, but I really connected with these conditions. They're conditions that are just underserved. The traditional way of treating them isn't great. And the things that we can potentially do to help these types of people are just incredible. So I've really dug into the migraines, the concussions, and the dizziness, and we're gonna we'll get a little bit into that in some other talks that I'm doing, but we'll touch on some of that today. Okay. In order to teach you what chiropractic neurology really is, there are a few core concepts that I need you to understand first. And the first one is the nervous system. The nervous system is what controls and coordinates all the functions in our body, and it includes our brain, but also the brain stem, the spinal cord, and these little noodles that come out of the spinal cord called nerves, which control everything. Everything from moving to thinking to breathing to regulating your heart rate to digestion. Anything that you can think of is controlled by that nervous system. So it's very, very, very important that we keep our nervous system healthy so that our brain can control and coordinate all our functions and we can, work or function as optimally as possible. Now, the next concept is what a brain cell needs, also known as a nerve, to survive. What do these brain cells require to be as functional and as healthy as possible? Now, the first one is oxygen. Obviously, we know we need to breathe. There's many ways that you can go about improving your oxygen. Deep breathing exercises, just physical exercise in general can be really good with that, but we got to make sure that we're getting good oxygen to our brains. Next is nutrition. We need to make sure that we are putting good things in our body. And that's one of the things I love about working at Root Cause is that we have an entire functional medicine team that's aimed at the nutrition aspect, the hormonal balance aspect, making sure that you have a fantastic internal environment so your brain has good building blocks. It can do what we want it to do. I've found in practice that people that don't have such great nutrition or hormonal balance, they don't tend to do as well with the neurological rehab, and that's because they don't have the building blocks to build those, you know, stronger connections in the brain. So very, very important that we're incorporating nutrition when we're talking about overall brain health. The last one is one that's missed a lot by even the medical community, and that is activation, stimulation. The brain needs to be stimulated in order to get stronger and grow. It has a very, very, very strict, if you don't use it, you lose it policy, meaning if you're not firing off a brain pathway over time, that brain pathway is going to die off. The brain's going to forget that it was ever there in the first place. So we need to be activating our brain. And one of the best ways we can activate our brain is physical exercise. I tend to get a little bit more focused on specific areas of the brain that aren't doing their job so well, but in general, physical exercise is one of the best things that we can do to just stimulate and activate our entire brain. And that brings us to this next slide here, which will just kind of show you how important, you know, activation really is, especially as we age. So this right here is an MRI of a 40-year-old triathlete's thighs. So it's as if they sliced you off at the thighs and are looking straight down. You have that white in the middle, that white spot, that's the bone marrow. Then you have the black that's around the bone marrow, that's the bone itself. Then you have the gray surrounding that, and the gray is the muscle. So that's the muscles in your thighs. Notice they're nice and plump. They're a nice even gray. Then around that, we have a white rim. That is the fat that lives underneath the skin. We're supposed to have a small layer of fat underneath the skin. Okay. This is that same type of image from a 70-year-old who is sedentary, meaning that they are not moving that much. And I want you to just kind of note the differences here. They still have that bone marrow in the middle, but then the black ring around that marrow is basically non-existent. This person has very, very, very poor bone density at this point. Then you look at the gray around it, it's shriveled up, there's black in there, there's white in there, there's basically fat growing into that muscle. That muscle is basically wasted away. This person's not functioning so well right now. Then they have all of that white fat around the muscle. Look how much more fat there is compared to the 40-year-old triathlete. All those black lines in the fat, that's vasculature, that's blood vessels that have been growing throughout that fat to try to keep it alive. This person's not moving so much, and this person's not moving so much because they haven't moved in a long time, which brings me to this next one. This is an MRI of a 70-year-old, same age as the last person, but they're a marathoner. They use their body. And notice the differences here. It looks almost identical to the 40-year-old triathlete. This person's even more lean. There's even less fat around right beneath the skin around the muscle on a patient like this. So this just goes to show you, you don't age because you don't move. You need to move, okay? You need to move if you're going to keep as healthy as possible. All right, the next concept that we need to talk about is the concept of neuroplasticity. And neuroplasticity in a nutshell is that the brain changes as it learns something new. It's supposed to adapt to what's thrown at it and do better. And as the brain learns something new, it grows new connections to do that job. These new connections that the brain grows is what's known as neuroplasticity, building these connections. These new connections allow the brain to become stronger and more efficient at whatever they're trying to do. Now, this can work for you or against you. We try to use it for you by, having proper posture, balance, exercising appropriately, but bad habits can build poor neuroplasticity. So your brain can get really strong at doing the wrong thing. That's why it's really important that we focus on ergonomics, on how we're exercising, on how we're using our body, especially when we're sitting and working and all that, because we want the neuroplasticity we build to be good. We want it to work better for us and not against us. Now, in order for us to build proper neuroplasticity, it's really important that we have the right building blocks. We need to have proper nutrition to build those nerves up as best as we can. Again, that's why it's so important that we address nutrition and hormones when we're talking about building brain strength. Now, the last thing about neuroplasticity is that building it usually requires a lot of repetition. Think about when you're trying to learn a new sport or an instrument. When you're just starting out with it, it's very challenging. You have to think about every single move, but then as you practice after weeks, after months, after years of doing it, it becomes second nature. The brain doesn't have to do that much thought to do these kinds of activities because it's built that plasticity. It's built that strength in there, and the brain knows how to do it, and it's very comfortable doing it. Neuroplasticity is one of the most important concepts we're going to learn today because that is what really drives the rehabilitation. We are trying to build that brain strength as much as we can in the right areas of the brain to make your body function better. This is a fun little questionnaire that I like to throw out there, which is how many connections are there in your brain? Before we even get to that, let's just wonder, how many brain cells do you think there is in the average brain? Well, there's about 50 to 100 billion brain cells in the average brain. Now, each brain cell has the possibility of building up to 10,000 connections with other brain cells. That doesn't mean everyone's going to build 10,000 connections, but they have the ability to build up to 10,000 connections, which means there's somewhere between 100 trillion and 1 quadrillion connections in the brain. This is an absurd amount of activity that's going on in the brain at any given time. And what can happen over time of misuse or through trauma or through poor nutrition, inflammation, these connections can start to die off and they can start to rewire in a poor way. And when these connections start to die off or not be as efficient, it leads to symptoms. It can lead to abnormal thoughts, abnormal movement, tremors. It can lead to pain. It can lead to abnormal posture. It can lead to headaches and dizziness and all sorts of things. We want to address this. You have to lose a lot of brain connectivity before it starts to show up on an MRI. But we know that there are people that have symptoms that their MRIs look totally fine. These are things that we need to address before they become an issue that shows up on an MRI. So as soon as you're experiencing symptoms, it's important that we get a hold of this. Now, I would argue that we want to start worrying about brain health before we experience symptoms so that we're less likely to experience them in the first place. But especially if you're starting to feel any kind of symptom, it's really important that we have some assessment done to figure out, where is this coming from? What can we do to strengthen your brain so that it doesn't become even more of an issue down the road? Okay, which brings us to chiropractic neurology. As I had said earlier, chiropractic neurologists or functional neurologists are board certified in neurological diagnosis and rehabilitation. Our job is to identify your condition as specifically as possible. Not only give you a diagnosis, tell you this is the condition that you're dealing with, but also why. Where is it coming from? What can actually be done to help these kinds of things? Because a lot of these conditions, concussions, dizziness, they don't have great treatment options in the traditional medical model. You're told either just rest or it'll pass, or there's nothing that can be done, or you're making it up, it's all in your head. We know that that's just not true the majority of the time. It's just that traditional, medication and a lot of surgeries, they just don't address these kind of symptoms. So, the traditional community is just kind of left shrugging their shoulders and they have nothing else to tell you. That's not their fault. They're using all of the training that they've got to try to figure out what's wrong with you, but sometimes it's just, beyond that training. And that's where somebody skilled in rehabilitation kind of comes in, because we're able to look at a lot of that gray area in between. And what we do is design targeted exercises and therapies to try to build plasticity as much as possible in your brain. So we try to figure out where in your brain is the issue. What therapies do we need to design to activate or stimulate that part of your brain to build more brain strength in that area? Obviously, it's non-invasive. Most of the therapies that we do are ones that you can do at home. You don't need any special equipment. You don't need anything besides, a dot on the wall, your thumb, and your legs. You can do this very, very, very simply. Now, there is, fancy equipment we can use to push you along or sometimes get a better effect, but it's not always necessary. And the most invasive that it'll typically get is some kind of electrical stimulation, very benign stuff like you would experience at the physical therapy office or something like that. Now, I specialize primarily in migraine, concussion, and dizziness because that's what I'm passionate about. There's a reason why those three conditions tend to go hand in hand. I treat them because they're honestly very similar conditions. The same areas of the brain that are typically affected in migraine are typically the same areas that are affected in concussions, the same that are affected in dizziness. So they rehabilitate very, very similarly. Obviously, there's a lot of nuance in between, and why these things come about in the first place. But as far as the rehabilitation component, they often look very similar between the three of them. So that's why I, have found that I get great results treating the migraines and the concussions and the dizziness. But there's a lot more that chiropractic neurologists are treating. A lot of them focus on chronic pain. I do focus a bit on pain as well, because they tend to do really well with these treatments, especially as adjuncts to traditional musculoskeletal therapies and functional medicine stuff as well. Stroke is also a pretty popular one, especially in an outpatient setting. So after you got out of the hospital, you're cleared. Those residual dysfunctions, a lot of time, the chiropractic neurologist or the functional neurologist is able to just get you that little extra 5-10% that you're looking for. Multiple sclerosis, Parkinson's disease, tremors, traumatic brain injury, various types of bodily injuries, fatigue, all those tend to do pretty well with chiropractic neurology, especially when combined with other modalities like physical therapy, chiropractic acupuncture, functional medicine work, that kind of stuff. Now, a lot of people are also, mainly athletes, are using this kind of treatments to just optimize themselves as much as possible. I know I've treated a number of professional athletes who don't necessarily have any symptoms. They're just trying to optimize their body as much as possible so that they can be as sharp as possible. So you don't need to have symptoms to benefit from this kind of stuff. I've taken pro athletes that are already in the top 10th percentile in their balance, and can take them to like the 5th percentile. So lots you can do. Now, I really try to treat my patients as little as possible and give them as many tools as I can so that they can go home, do work, get whatever benefits out of the exercises and therapies I prescribe to them, and then have them in, we check on it, tweak things as we go. If I can do it that way, I will always do it that way. But there are certain sets of people who require a little bit more TLC, a little bit more time, and a little bit more of a one-on-one approach to get where we need to go because they're just too sensitive. And for those patients, we have what's called a 1-week program. Sometimes I call it an intensive. And basically what that looks like is we take a week, usually Monday through Friday, and we see you usually 2 to 3 times a day over those 5 days. And the purpose of that week is not to cure you necessarily, but it's to figure out how much progress can we make, what therapies work for you, what are your limits, and are you a candidate for this care going forward? Now, oftentimes we are able to see some pretty cool improvements over the course of those 5 days, but that's not really the purpose. It's mainly a boot camp to try to be super eyes-on, super hands-on with you to try to figure out as many solutions for you as possible in a short period of time. A lot of patients that do intensives, I can't have them go home and do exercises on their own because they might be too easy to flare them up, or there's therapies that they need that require hands-on work with another specialist. So if I can't trust that you can safely do certain exercises at home, or you just don't have the support at home to help you through these exercises, it may be necessary for us to do a 1-week intensive. Super effective, really, really great way to rehab people. Not necessary for most patients, but for people who are very, very chronic or have symptoms all the time, it may be the best way for us to go about your treatment. Okay, one of the biggest questions that I get is, okay, what does an exam look like? I've been to the neurologist, they've taken a look at me. The examination that we do is very in-depth. We can't rely on a brain scan or an EEG to tell us what's going on in a lot of these cases. So we need to rely on a very, very in-depth physical exam to try to glean information about what's working all right and what's not working as well. So we test lots of things. And the tests that we run, they're not anything super special. It's the information that we glean from those tests that gives us an idea as to what's going on. A lot of these tests traditionally are looked at, okay, we're looking for something really bad to happen. And if something really bad happens with that test, then you've got X disease. But they're ignoring all that gray area. There's a lot of stuff that can happen with these tests that may not be, oh my goodness, you're about to have a severe problem, but little signs that there is something going on. So we do a lot of testing of balance. We test your movement and your gait, how you're walking. We test coordination. We look at your sensation. We might check your reflexes. We look a lot at your eye movements, how they're moving around. Are they smooth, accurate, on point? We might feel your spine, feel your muscles, have you dual task, do different types of cognitive exercises. We might test your inner ear or your vestibular system to see how that's working. Usually my exam takes anywhere from 40 minutes to an hour or so to get through, because there are lots and lots and lots of tests that we have to do to try to pinpoint, where exactly is the dysfunction in your brain. If necessary, we'll get you out for lab testing. We'll order the imaging. We're highly trained in figuring out how and when that's appropriate. So no worries about that. But the exam, it's at the end of the day, it's pretty fun. We get to laugh at all the fun little games that we get to play to figure all that kind of stuff out. Okay, on to treatment with functional neurology, chiropractic neurology. There's lots of things that we can do, and we try not to go overboard with this because we don't want to load you up with 10, 20, 30 different therapies. We try to get as targeted as possible to focus on just the areas of your brain that need help. So that might entail vestibular rehabilitation, retraining your head movements. Maybe it's PT type stuff with Dr. Rupa in the physical medicine department, maybe some work with Dr. Alex or work with me on adjusting and muscle work and body work. But from a more neuro rehab standpoint, we may retrain your peripheral vision, retrain your eye movements. We might retrain your movement patterns. If we need to, we can get into nutritional and hormone regulation. I used to have to do all of that on my own. Luckily, I have a much more talented team here at Root Cause with the functional medicine side of things, who they can handle all that stuff way, 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 way better than I can. So that's just another added benefit of working with us here, is you really have experts in each of their own fields, so we can give you as well-rounded and just strong of an approach as possible. All right, the next question I get is, okay, what kind of exercises do you do? All the way to the right side here, we've got a couple of electrical stimulators that I use. The top one is a peripheral nerve stimulator to stimulate nerves along the face, sometimes along the arms and the legs. This just fires off those nerves and helps build strength in them. Then down below that is called the HVG stimulator, and that I use primarily for vagus nerve stimulation. So I can clip a electrode to your ear, ground it on your neck, and we can stimulate the vagus nerve with electricity, which has been shown in the research to be pretty effective at doing that in a non-invasive way rather than having to do an implant or something like that. Then all these other pictures are just different, dot patterns and line patterns to retrain eye movements and head movements. At the bottom left there, that person's wearing a laser on their head to retrain their head movements. So lots of things we can do to rehabilitate, balance and coordination and eye movements and all that kind of stuff. Now, when it comes to rehabilitation, obviously management is key. We want you to be as least reliant on this stuff as possible going forward, but you got to take care of your brain. Everybody knows that you should exercise 3, 4, 5 days a week. We need to put that same attention to the brain. Now, initially when you're working with me, you're going to be doing your therapies pretty regularly, every day, probably multiple times a day. But as we build that strength, I usually recommend you don't need to be as hardcore on them, but you do got to add them in a little bit to keep the brain sharp. And we'll try to, switch your exercises up and make it as fresh and new as possible, because that's what the brain likes to grow. But you got to add brain health in with your physical health. So, whenever you're going to do your physical exercise routine, start and end that exercise session with your brain exercises, so that you're making sure to focus on your brain as much as your muscles and joints. Just super, super, super important. And it keeps you from regressing and keeps you from having to do more consecutive treatments. It basically keeps you out of my office. So please, take care of your brain. That's really all that matters. Now, we do want to get checked up periodically to make sure everything is going well, but the more that you take care of yourself and your brain, the less you're going to have to rely on somebody like me. Now, I am in a position where I get to help people who have been told that there's nothing that can be done. I've been used as a last resort, last ditch effort to try to get any kind of improvement. And a lot of those people, the majority of those people, were able to help in big ways. The problem is not enough people know that these kinds of services exist, and I'm on fire about this. We need more people to know that rehabilitation is an option for these kinds of conditions, that people don't think there is any other option. So please, if you're not dealing with anything like this, but you know somebody who is, please tell them that there's another option for them. I'm not a magician. I can't fix everybody. I can't help everybody. If anybody tells you they can help you no matter what, then I would run the other way, because that's just not how rehabilitation works. That's not how healthcare works. But what I can say is I really care about helping people. And if you haven't tried rehabilitation, you owe it to yourself to give it a shot, because any rehab has got to be better than none. And it's a really, really valuable and potentially effective tool. So please tell the people that you know that there are other options out there. If they're not around here, they don't want to work with us remotely, please still have them get on the phone with me. I will try to help them find somebody near them to help them. We need more people doing this kind of work, and we need more exposure. We need more people to know that this kind of stuff is out there. So please, please spread the word. It means a lot to me, and it would mean a lot, I'm sure, to all your loved ones who are dealing with these kinds of things. That is about it. Thank you so much for spending a little bit of time with me today. If you have any questions, you can always get on the phone with me. I'm always happy to chat with you and figure out some kind of solution for you. Again, my name is Dr. Dan here at Root Cause, and I hope you have a wonderful day.